Now, health ministers from across West Africa are holding an emergency meeting in Ghana on how to tackle the biggest ever outbreak of Ebola. Now, the death toll has risen sharply in the past week. 467 people have now died from this deadly virus. And since the outbreak was first discovered in February, almost 760 confirmed or suspected cases have now been found, and significantly across 3 separate countries. Guinea was the first to report. So far, 303 people have died there. Then it moved into Sierra Leone, where it's killed 99 people. Liberia has had 65 deaths, and that makes it the biggest geographic spread in any Ebola outbreak. Now, there's no known cure, and up to 90% of all people who get the disease die. From the US, Robert Ray has more on the effort to study this dangerous virus.
In Atlanta, the Centers for Disease Control and Prevention says the Ebola outbreak in Africa's Guinea, Sierra Leone, and Liberia is the most serious they have ever faced, with over 350 deaths, hundreds more infected, and a region without medical infrastructure to combat the spread.
What's happened over the past few months is that the infection has spread to multiple areas in all 3 countries, and there's now sustained transmission.
The CDC headquarters here in Atlanta does not have any Ebola specimens from this particular outbreak in West Africa, though what they are doing is they are studying the fruit bat, which they think could be the host or reservoir for the virus and other fever-based diseases. The CDC has had response teams deployed in West Africa since April, including fever virus scientists and epidemiologists. Those are people who chase down and identify patients.
We know what works to control these outbreaks, and that is active identification of patients, getting them into proper isolation and treatment as soon as possible, and then importantly, following up all of the people that they've had contact with to monitor for symptoms to determine if they will become patients.
As the death toll rises, the World Health Organization is urging drastic action, and the CDC says a massive effort of multiple people on the ground is required in each of the affected regions to help identify the infected and slow down the spread of the Ebola virus, of which there is no vaccine and no cure. Robert Ray, Al Jazeera, Atlanta.